Hi, this is Addie. She's been in our shelter here for 3 days. Her heart rate is 120. Her blood pressure is 125/75. Her respirations are 30 beats per 30. Her oxygen saturation is 99%, and her temperature is 100.1. She's been irritable and agitated. She does have a history of traumatic incident. Oh, my computer just shut off. Cool.
Hello.
There we go.
Oh, here we go.
Are you back?
You guys, let me interrupt you. Can you guys hear me okay?
Yes.
Okay. And so I was just hearing you. You were cutting in and out a little bit. So I'm Dr. Lester. I'm one of the psychiatrists here at OSU. Did I hear you say that your name was Gabby?
Addie, with the
Addie. Okay, Addie. What's going on right now?
in terms of like where am I, or in terms of how I'm feeling? Or...
Yeah. Why did the staff there at the shelter want you to talk to me?
I've been really irritable, and I'm anxious, and kind of panicky, and I've been having a lot of flashbacks to my incident when I was.
What happened in the past?
My parents died in a subway incident. I was involved with Hurricane Sandy. Our subway car filled with water and they drowned.
That sounds terrible. When was that?
That was in October of 2012.
Addie, how old are you?
I'm 16 years old.
You said you're 16, is that right?
Yes.
Okay.
Sorry for the delay. We're operating off of a hotspot or a MIFI device that was provided. With the storm coming in, we may see some interruption because of the high winds and things like that. No, she disconnected. She's reconnected.
So, Eddie, I'm sorry you keep cutting out a little bit, but what brings you to Ashland?
After my parents passed away, I had to move in with my grandma and my grandpa. So I'm living with them.
Okay. And so you said this happened about 3 years ago?
In 2012, yes.
Okay. And then you must have just been through this tornado, and that's why you're here at the shelter?
Yes, I was on the way to the grocery store when I heard the radio tell me to go to the nearest shelter, which was here. So, I came as quickly as I could.
And where are your grandma and grandpa?
I don't know.
You haven't had any contact with them since the tornado?
No.
And so you said you were having terrible flashbacks.
I'm feeling like I can't.
Sorry about this. Dr. Lester?
Yeah.
It's storming pretty bad outside here, and so we're thinking that we're having some issues with the Wi-Fi or the Wi-Fi that they provide us for the demonstration project today. We can't keep a good signal on it, so that's why you keep chiming in and out. Sorry.
Okay. No, that's okay. Yeah, we could have a real world tornado on our hands in a minute. Brittany, what's our plan here?
We're gonna try and carry on. Right now we're down to 2 bars on the MIFI. So hopefully we'll hold a signal here and try and carry on and at least complete this first one.
Okay, are you able to see me because I have no video?
Yes, we can see you.
Okay, so I'll just keep going, and then hopefully my video will be back up. So Addie, you were saying that you were having a bunch of flashbacks. Tell me more about that.
I'm feeling like I can't breathe, and it feels like it did during the subway. I'm panicky. Again, I can't breathe right. And when I'm resting or trying to rest, it doesn't work very well. I have a lot of flashbacks, and I think about the subway and how it felt to be trapped.
And had you been in treatment or counseling or anything after this happened in the subway?
Not extensively.
Had anybody ever diagnosed you with depression or anxiety or PTSD or anything?
I have not been officially diagnosed, but they believe that I suffer from post-traumatic stress disorder.
Okay. And were you ever on any medications, like through your pediatrician?
No.
And some people with PTSD have symptoms that last for a long time, and other people have times where their symptoms might be bad, and then they get better over time. What's been your experience?
I've just been kind of withdrawn. It fluctuates a lot. Sometimes I'll be okay, and then the next day, little things tend to set me off.
Has it gotten worse since you've been in the shelter?
Yes.
And is there anything about the tornado experience? It sounds like there's some parallels to what happened with your parents.
I'm just feeling really trapped. I don't feel like I have any sense of security. I'm scared.
Have you been able to sleep?
Not well, no.
How many hours do you think you might be getting?
2, maybe, on a good night.
How's Jude been?
What was that? I'm sorry, I didn't hear your question.
Or mostly anxious, or just worried, or angry?
I've been stressed out and worried and angry. I'm really scared and sadness. I'm pretty sad, I guess you could say.
That's all pretty understandable. It sounds like you must be really worried about your grandparents.
Yes.
Sometimes when people are going through a hard time, they start having thoughts about hurting themselves. You been having any of those thoughts?
No, not really, no.
What about like cutting yourself, burning yourself, taking overdoses? Any thoughts about anything like that?
No.
And do you have a history in the past of ever trying to hurt yourself?
No.
Do you have any medical problems?
No.
You don't take any medications for any medical reasons, asthma, allergies,
No.
high blood pressure, nothing like that?
No.
And sometimes when people are going through these sorts of problems, they start hearing voices that aren't there,
No.
or seeing things that aren't there.
No.
And then what about nightmares? Nightmares been a problem for you?
A little bit. I have a lot of nightmares about my family and where they've been and where they are. I miss them a lot. And some nightmares about the subway incident again.
And you said you'd only been sleeping about 2 hours a night. Is that because of nightmares, or is that because you're in the shelter?
I think
Yes. How were you sleeping before you came into the shelter?
a little bit better, maybe 5 hours a night. Not a lot better, but a little bit better.
But you were having nightmares back then as well.
Some. They weren't as frequent, but a couple.
And so, Addie, how do you think that I can be of help to you today?
I don't know.
Well, I have some thoughts. One thing is, I know that you're here in this mass shelter situation. It seems like there are a lot of people there. And I can imagine that that's pretty frightening.
Yeah.
And it seems to me that you're experiencing a lot of what you call flashbacks. I think that's a pretty accurate term in terms of reliving some of what you had been through in the past.
Yeah.
So one thing that we could do today is potentially give you a medication just on a short-term basis that would help with that flashbacks and help with your anxiety level.
Okay.
Okay? Now, do you feel safe there in the shelter?
Not really.
Okay.
But I don't
What's
feel.
the,
I don't know.
has there been any word that the shelter is going to be able to be, you guys are going to be able to leave the shelter sometime soon?
I guess I'm a little bit worried that it won't happen, but not really. I know that eventually we'll be able to leave.
And I know you had been talking to a nurse who was there, and it seems like there's some medical personnel that can be of support to you.
Yes.
And so if things get worse, you would be able to let them know, and then we can chat again?
Yes.
Okay, well, if it's okay with you, I'd like to talk to the nurse then about medication.
Okay.
I'm right here.
Okay, I'm sorry, I still don't have a video.
Oh, that's okay.
So, I think what I would recommend for Addie is we could give her some Ativan, a 0.5 milligram, up to 3 times a day as needed when she's having really serious flashbacks. And the other medication, you had told me her vital signs, but you were actually cutting out, the audio was cutting out at the time. What is her blood pressure?
125 over 75.
Say it one more time.
125 over 75.
Great, over 70.
Mhm.
Great. So if we could also give her a medication called MIFI. We can give her 1 milligram at night, and that's going to help her with her nightmare.
Okay, so Ativan, a 0.5 milligram 3 times a day, and mini press 1
As
milligram
needed.
as needed, and mini
That's
press 1 milligram at bedtime.
At bedtime, right?
Okay. All right. Any other prescriptions?
I
or
have no
anything
other
else we need?
orders.
Okay.
I would just say it sounds like she's going through, she's been through one terrible traumatic experience in the past and is going through another one now. So just to the extent that the staff available there can give her some support and help her with resources, particularly in trying to find her grandparents or find out what happened to them, I think would be really important.
Sure. All right. Well, we will do that.
Okay.
Are we all done?
Yep.
Okay.
Anybody have any questions?
Do you have any more questions for the doctor before we go?
No.
All right.
Okay, Dr. Lester, I think we'll wait to our next patient. So if you want to go on ahead and disconnect, we'll wait till we have our other patient ready.
Great, thanks.
Okay, thanks. So we couldn't have planned this if we wanted to today. We do have some severe storms moving into the area right now. Our hotspot is down to 1 bar barely. And the great thing about this technology, and I promise you I didn't plan this, is that it adjusts. So basically, when you have a bandwidth that's decreasing, just like on your cell phone when the bars are going down and you're like, I can't hold the call, the technology will adjust to try and maintain or keep one or the other, the video or the audio. And in this case, they kept the audio and the picture of our physician on there so that the patient could still be seen and evaluated. So that's one thing, or one reason why we did select this vendor to partner with in our emergency situations, is because their technology has that ability to basically adjust the bandwidth so that it will maintain one or the other instead of just disconnecting everything. So we appreciate your patience today. Are there any questions related to how this went? Yeah.
With respect to the scenario, being in a shelter with presumably, cot after cot after cot, is there a problem? I would think patients wouldn't necessarily be comfortable just sitting there, talking about how they're feeling, if they're having nightmares, what are they about, with people potentially coming and going right next to them or all around on that.
So a privacy type of.
Right.
So you do have the ability, and Ken, correct me if I'm wrong, do you have the ability to do the privacy on this one?
Yes.
Yep.
So what a Bluetooth headset thing or headphones with a microphone on it.
So they can basically talk in a level like this?
Yep.
And not necessarily everyone can.
Just like you use your earbuds for your cell phone. Our larger robots actually have a privacy handset on them that they can just pick up and actually talk like you're talking about the telephone communication. Yep.
But right now, this is for your benefits that you can see and how this demo is supposed to work. But if it were a real situation, then there'd probably be a separate booth where we'd want the patient to talk to the psychiatrist, because for a patient with a mental challenge, it's difficult to open up when there's so much going on, where there's probably people shouting or shrieking or crying. It kind of doesn't help in developing that rapport with the psychiatrist. So if things were supposed to be in a real-time situation, we'd have a separate booth that was locked off or cordoned off from the rest of the location, whatever's going on there. So
But then is there someone, like maybe the nurse standing just outside the room in case the person,
she could be standing,
I don't know,
yeah, so that
That
she
would
can
be
see
all
how,
protocol designated by.
because she would need to know how the interaction has gone, what notes need to be taken, and how the prescription needs to be followed. So she would have to. If we're done, I'll bring in the next one.
Go on ahead.
So the machine made a decision based on it doesn't have enough power to keep everything going, that it's more important for the patient to see the psychiatrist than for the psychiatrist to see what kind of reaction that
That would
patient's
kind of have
having.
to be weighed out. So one is, yes, the patient, knowing that they're actually speaking to a real psychiatrist and they're really evaluating. The other situation of that could be, yes, if they need to look at their pupils or anything like that. I didn't want to delay it any further, but we could have had her disconnect and try and reconnect. We brought the hotspot back towards the door when we were getting a better signal. So, if you guys stay around for the next one, you'll be able to see what she sees. She can actually zoom into the pupils of the patient. She can actually turn her head a little bit and look around the room just a little bit, but,
But when the power gets low, the machine is making a
yeah,
decision.
it is.
But Brittany,
Yes.
what Ken said is, if this were a real disaster zone, you would bring in what?
We have a much more powerful box rather than just a,
MIFI.
what
They
we
would
call
have
it, consumer grade
antennas,
MiFi, the stuff that we use in ambulances and whatnot. It's a much more powerful box with external antennas that work on different frequencies. I'm getting too technical on that.
No, that's good.
That's
far
We
as
can
I'm
we can
good.
put a couple
Yeah.
different antennas up outside, run some cables into a box, and then power several of these off of that at the same time and have a much more reliable connection than just a consumer grade.
Yeah, right.
That's the other thing with those, they have a much further range, where this one is only connecting to whatever the closest cell tower is. The ones that we use in emergent care situations will go out much further from that.
Tied just to AT&T or Verizon?
Verizon 4G LTE is what works the best.
Works here the best.
You had a question?
Yeah, yesterday we were discussing the release for the treatment.
Oh, yeah.
What is the procedure then for that in the mass shelters?
So, one would be the protocol that you guys designate, for your shelter event. So if you guys have a written release, like we do in the emergency room, any patient that comes in for any type of telemedicine, program in the emergency room, they have the general release for the ED, and it has a little blurb in there designated by the hospital that says your, care could be given by a telemedicine provider through technology today. So you could designate to have that on your release. However, if your protocol is just to ask for verbal consent, then you can do it and designate it that way as well.
Yeah, the forms that the nurses are using have a consent portion on it, so just for the sake of this demo, we came up with that so that we could give sort of a real feel of what it should be and how it should be. Obviously, it's open to more changes and improvisations, but for now, we did come up with that on the sheet.
That answer your question? Okay. Any other questions?